So nice to be here today and to be here with you all and to learn from you all. As much as I'm here to share a few remarks today, I'm really here to learn and appreciative of this opportunity. We talked a little bit today about how the only two certain things are death and taxes. So today I'd like to turn our attention to health and taxes and how a specific type of tax can be used for public health purposes. Um, I am Aysha Pamukcu. I'm a senior attorney at ChangeLab Solutions. And here, clicker gets going, is a little snapshot of what we'll be talking about today. Just what are sin taxes exactly, and how can we use them as a public health tool? Who's using this tool and who might benefit from it? And then, of course, diving into questions of health equity and unintended consequences, and then asking some questions that will get a little bit to the future of these taxes. So before I get started, I just want to let you know a little bit about who we are at ChangeLab Solutions. We are a nonprofit here in Oakland, and we are in the business of law and policy solutions that address the ingredients you need for a just and thriving community. This ranges from smoke-free environments to healthy retail environments to safe, affordable housing. We cover a lot of ground, and a slice of that is taxes. And I would also be remiss if I didn't point out our website, where we make a variety of our law and policy tools available for anyone to use. I share this in the hopes that some of you may find this useful. So I'm going to just start by asking, what are we talking about when we're talking about sin and taxes? Why are taxes involved in questions of sinfulness? It sounds maybe a little strange and a little Puritan. So let's break it down. Taxes are, in this scenario, we're talking about a special consumption tax. So we're talking about special items in the retail environment that you can consume. Tobacco is a great example, alcohol, the brave new world of cannabis. The gas tax is another really familiar example for most people. And then there's this question of sin, and what that is getting at is that the commodities that are the subject of this tax, this excise tax on a particular good, is somehow immoral or undesirable or harmful to the individual or to the community. And while that may be the case, I would posit that a sin tax is about as helpful to the public health community in terms of phrasing as nanny state and other lovely terms like that that really can dog some of our best work. So I would actually put it to this group today maybe to think about reimagining the sin tax as something that's less stigmatizing and less off-putting and more affirming and positive and a force for positive social good. And as Christopher was talking about, we can be more explicit about making the connection between public health and taxes. Of course, taxes have a primary and well-understood purpose of raising money for the government. But in addition to that, they're a really good tool to nudge consumers, to change behavior, and ultimately drive sort of a collective norms change. And there's actually a lot of precedent for this, starting with one of the very first American taxes on whiskey, all the way up to the contemporary tobacco tax, which is in effect at the federal government in all states, as well as Washington, D.C. So it's a very common and well-precedented concept. And in addition to providing a nudge for consumers, these taxes also provide really important funding for preventative public health efforts. These taxes can raise money that counteracts the high costs of certain commodities. So, for example, while we see sugary drinks as a food item that's relatively inexpensive to produce and relatively inexpensive to consume and purchase, the costs that it imposes on society are high. So these are, again, returning to the concept of externalities. It can be very expensive for individuals through increased health costs. It can be very expensive for communities through decreased overall community wellness. And this is especially true for those communities that have the highest burden of these commodities and of associated chronic disease. So diving more specifically into a couple reasons that public health would be interested in taxes, the first and one of the most compelling is that it addresses common health disparities. The burden of chronic disease caused by unhealthy retail commodities falls most heavily on underserved communities, like communities of color and low-income neighborhoods. And this is something that we all know as public health professionals, and we also know it just as individuals living out in the world. If you think about your own neighborhoods and you think about where the liquor stores are clustered, where the payday loan shops are, where the fast food restaurants are, chances are those are the neighborhoods that also have the most advertising for these commodities and bear the highest cost of the negative externalities of these commodities. The second thing is that this builds on existing public health strategies. Taxes, however complex and intimidating as they may be, are one tool in the toolbox of public health practitioners. And we should look at it that way, as simply one tool among many. I like to look at the world of alcohol control as an example, where we have taxes as a tool to reduce the negative externalities caused by binge drinking, which we can all understand very intuitively the harms that that cause. But there's also other complementary tools that have a very strong evidence base. There's restricting the density of places that can sell alcohol. There's maintaining limits on the days of sale. There's enforcing laws that restrict places from selling alcohol to underage kids. When we combine all the tools in the toolbox, then we get to combating the negative effects of binge drinking and the harms that they can cause. Finally, another compelling public health reason to get involved in taxes is that it produces funding for community health priorities. It's really no secret that there's never enough funding for public health work, and oftentimes these taxes can be earmarked for specific purposes. And what's more, this earmarking process is a really great opportunity to consult with the communities who are most affected by these unhealthy commodities and allow them a voice at the policy table. It really does bear repeating that if you're not at the table, you are on the menu. So that point is very well taken. And just to look at what we're talking about when we are mentioning these commodities, this is just some examples to get you thinking about what we mean here in a really concrete way. So we have substances like tobacco, alcohol, cannabis, nutrition aspects that affect the healthy food environment, sugary drinks, junk food, maybe specific ingredients like high fructose corn syrup, and then we even have specific behaviors like gambling or driving or pollution. So it's a very broad universe, and here I'm just going to narrow our focus to excise taxes specifically on consumable goods. And I share this infographic that we recently developed just as an example of how we might be able to think and visualize the relationship between taxes and public health. So you'll see how there's a flow from alcohol tax laws to an increase in price in the commodity, to a corresponding reduced consumption, and then finally improved public health outcomes. If we zoom in on another example with tobacco, we see on this chart the smoking rates in the United States from all the way through, from 1900 all the way through 2010. And we see that the smoking rates are pretty consistently spiking up. This is an example of the unintended consequences of public policy, with the American government sending cigarettes to troops abroad intended as a comforting gesture. Of course, these addicted troops came back and affected the smoking behaviors of their families, again driving this spike. And then we see some education campaigns. We see the first Surgeon General's report, and that drives the rates down a little bit. But it isn't until we see public policy interventions, like the start of the non-smokers' right movement and the doubling of the federal cigarette tax, that the rates really decline and maintain a decline. So that's a happy example of the intended consequences of public policy and potentially where taxes can slot into that. And if we want to talk specific dollars, we can look at California as an example. In this state, we had a comprehensive messaging and public policy campaign, and it produced huge savings for the state. We saved $134 billion in personal health care expenditures, and we're talking a 50-fold return on a $1.8 billion program investment in the California Tobacco Control Program. And then correspondingly, we see the tobacco industry take a hit, and we see 6.7 billion fewer packs of cigarettes sold. That's worth $28.5 billion in pre-tax sales to the tobacco industry. So this is just to illustrate the flow of money towards preventative public health and healthcare cost savings and away from negative influences like tobacco. And to dive in a little bit more detail to the equity aspects, using tobacco again as an example, we see that even though the last slide looked pretty promising with rates of tobacco dropping, it's not a straight win across the board. There's complex considerations of equity and fairness to contend with. So we see that smoking rates did decline across the United States, but not all populations experience that decline and the corresponding health benefits in the same way. Smoking rates are disproportionately high among folks who are multiracial, Black, white, and highest yet among folks who are Native American. Younger people are more likely to smoke than older folks. And among folks who are poor, uneducated, or in rural communities, rates remain disproportionately high. So what happens, and I think has been really well illustrated today, is that one policy creates unintended consequences or new nuanced problems where disparities persist. And the public health field and the tobacco control field will have to evolve accordingly to craft more nuanced and equitable solutions that are tailored to the needs of populations who may be left behind by recent policy successes. So let's think about who might be using this tool. We know the federal government's taxing. We know that states are taxing, but increasingly we're starting to see more local governments employing taxes on specific commodities as a public health tool. In the Bay Area, we've seen a lot of movement on the sugary tax front, for example, with Berkeley leading the way. But of course, there's a wrinkle, and this is actually something that Nick just alluded to, which is that a major restriction on any local government's ability to tax is preemption. And this means that the law of a higher jurisdiction invalidates the law of a lower jurisdiction. And how this plays out is really a state-by-state issue. And we can return to our alcohol example to illustrate that a little bit. Recently, we did a paper studying where local governments can enact alcohol taxes. This is what we found. This rainbow chart kind of shows you the variation in taxes, in local government's ability to tax by state. There's a lot to see here, but high level, what I want you to take away is that 19 states allow local governments to tax alcohol. The rest don't, so that's not even an option. Among those 19 states that allow it, there's various restrictions on how local governments can tax. It might be a restriction on the type of commodity, so beer's okay, wine's not. It might be a restriction on the amount of tax, or it might be a restriction on how those funds can be earmarked. And I highlight this just to show that while we're seeing a lot of innovation at the local level, local government's ability to innovate on taxes really varies across state and by commodity. If we looked at a map of local government's authority to tax tobacco, we would see a very different range of colors on this map. So in thinking about taxes and thinking about the winners and losers of taxes, it really behooves us to ask the question, who's benefiting and how? When we apply health equity considerations to our policy work at ChangeLab, these are some of the things that we walk ourselves through to make sure that we are keeping health equity in mind and also checking our blind spots. One of the first principles is community partnership and education, and this is really just recognizing and respecting that people who live in the community are the experts on themselves, their lives, and their neighborhoods. And so it's really important that we get these folks at the table, especially when we're talking about tax policy and policy making more broadly. The next principle is basically about creating a positive ecosystem of health. The field of public health is often rightfully concerned with how do we get these negative influences out of a community. There's too many liquor stores, there's too many payday shops, there's too many unhealthy influences. But just as we are concerned with that, we also should concern ourselves with how do we make sure that positive, healthful influences are flowing back into the community. And in the framing of taxes, getting to this next point, that often comes in the form of earmarking equitably. So making sure that these tax dollars are going to the folks who bear the highest burden of chronic disease and unhealthy commodities, and that it's going to their priorities as they articulate them for their communities. Finally, we think carefully about crafting policy that doesn't stigmatize individuals or groups. One of the tricky things about tax policies that affect individuals, say a consumer tax on the price of a cigarette pack, is that this can create the false idea that, that wellness is the product of your individual choices, and that's it. Obviously, we all in the room know that that's not true, and there are broader systemic forces pushing on us every day that determines our personal and community wellness. So it's important not to lose sight of that when we're looking at things like consumer-based taxes. To dive into unintended consequences and blind spots a little more, I'll just highlight a couple issues that can arise, certainly not a comprehensive list, but things that we actively think through at ChangeLab with our partners. The first, and this has to be acknowledged up front, is the regressivity of excise taxes. And when we look at regressivity, it's sort of like tax loopholes. It's a word that sounds pejorative, but it's factual. What regressivity means is that these taxes take a greater percentage of the income of poor folks. So are excise taxes regressive? And the answer is simply yes. However, what we have to do is zoom out and look at regressivity in the broader context of chronic disease, poverty, and other social determinants of health that are extremely regressive by nature, and look at taxes against the backdrop of all of those influences. Another unintended consequence is potential government dependency on the commodity for revenue. So this is pretty self-explanatory. In taxing tobacco, for example, governments may find that they are dependent on tobacco products themselves to raise those funds. Another potential unintended consequence would be undesirable consumer adaptation. And this could range from saying, well, I'm just going to go buy my cigarettes in the county next door, switching geographies, or it could range from product switching. Well, liquor is really expensive, so I'm going to drink beer. And then finally, I think another major drawback that we have to all be really mindful of is not pairing taxes with additional public health strategies. Like I mentioned earlier, it's a great tool, but it's one tool in a broader toolbox. So when we think about strategies, it's important to think about them holistically and how collectively we can pair them to move the needle. And then looking ahead and thinking about what the future might be for excise taxes, for what we're calling sin taxes, that that is a question for all of us in the room. It's a question for the broader public health community, and it involves thinking courageously and creatively about some difficult questions. How are we going to frame this tool moving forward? How are we going to combine it with other evidence-based strategies? How will we ensure that the most disadvantaged of us benefit from taxes and other public health strategies? So I would put those questions to us and say that perhaps with some creative and persistent work, we can reimagine this notion of sin taxes less as a buzzkill and an unattractive option, but more as a welcome lifesaver and a standard part of our public health toolkit. So with that, I thank you all very much for being here today and invite you to reach out to me today or through email to continue this conversation. Thank you so much.
Lovely job. Thank you so much. So at this point, I'm looking for the high sign about Xavier Morales and hoping that we can hear from him in just a moment. So Xavier, are you there?